primary hyperaldosteronism part 3. All right, and this one, I think it would be a good time to talk about how this condition is diagnosed. So I'm not going to do a whole big recap like I did last time. If you want to hear more about what primary hyperaldosteronism is and the symptoms of it, you can go and find part 1 and part 2 over on my page. But okay, so we're going to talk about how it is diagnosed. And this can vary for people depending on what kind of doctor you're seeing, if they're a specialist, and even with that, sometimes they do different things. So typically, the doctors that deal with the adrenal glands are endocrinologists. But typically, someone, if they're having like high blood pressure, they're having muscle weakness, they're having numbness and tingling, they're probably not going to immediately go jump to seeing an endocrinologist. You're probably going to just go to your primary doctor first, right? So typically, probably what will happen is you'll go to your primary, you'll explain some of the symptoms, they'll run some basic labs for you, and they may discover that your potassium is low. And this is what happened to me. My potassium was critically low, and then even after supplementing, it was staying low. So then it was kind of like, okay, well, what's going on here? Like, even with, giving it yourself a little boost, it's still not really getting into the normal range like it should. Or possibly maybe you've been seeing your primary care doctor and you've been having high blood pressure, and you're having or you're taking medication for it, and that's still high consistently. So typically you're starting out with like your primary, general physician's care, and just things with your blood pressure, maybe your sodium, potassium are off. So then it's like, okay, we got to figure out what the problem here is. So from here, they could send you to an endocrinologist, or they might even send you to a nephrologist. So this was the case for me. I went to a nephrologist first. It was actually a physician's assistant, maybe, or a nurse practitioner, one of those. I think she was a physician's assistant. But thankfully, she knew to check for a lot of things. She was being very thorough, because typically if things are off with potassium, like, they're probably going to want to check out what's happening with your kidneys first. So in my case, with my story, we checked out so many different things with my kidneys first. We looked into trying to figure out if there's like chronic kidney disease, if there's all these different genetic things that could be causing it, because there's a lot of genetic, well, I shouldn't say a lot. There's a handful of genetic conditions that also can cause the low potassium and some of these other things. And in my case, the genetic things didn't come up as positive for me. So at that point, the nephrologist that I was seeing, she also tested me for something called aldosterone, and the other one is renin. And then you also are checking for that aldosterone and renin ratio. And again, I'm not a medical professional, so I don't know the exact workings of this, but aldosterone and renin are something, they're supposed to be working together. They're kind of supposed to ebb and flow together. So if, when you're checking the ratio between those two things through a blood test, if the ratio is very high, like your renin is way too low, and in comparison to that, your aldosterone is high, that's giving the indication that you have too much aldosterone, and that those things aren't flowing together like they're supposed to be. So very quickly, she did this test for me, and thankfully she did. And that was one of the things that was discovered, that my aldosterone renin ratio was high. But we still wanted to rule out some other things too. So we did that first. So after, this might have to be split into other parts. I'm getting kind of long here. So checking for the aldosterone renin ratio through a blood test is going to help a lot with figuring out if this is a condition that you may have. So once that's established, that in combination with your symptoms, you might continue working with that nephrologist, or they might send you to an endocrinologist. In my case, I was referred to a nephrologist at the Mayo Clinic, Rochester. And that was really definitely the turning point of finding answers for me, because I went to see this nephrologist and he pretty much immediately said, yeah, I'm pretty sure you have primary hyperaldosteronism. So these are the steps we're going to take to find out if this is what it is. So the next step was to recheck that ratio and just make sure it was still high, which it was. I also did a cortisol swab just to see where things were at with that. My cortisol was fine. And then I had to do a, what was it called? Oh gosh, no, I can't remember what it was called, but salt loading test. Yeah, salt loading test. I have one little video about this. So basically for a few days, I had to just consume a ton of salt. I had to have a lot of sodium. And then I had to do a 24-hour urine collection and then send in a sample of that urine to be analyzed, because basically if you are having tons of sodium, then your aldosterone, like it should be responding in a certain way. But if you have the condition, then it's not going to do that. And again, I don't know all the details, but basically when I did the salt loading test, it showed, yeah, your body is not responding properly to this huge amount of sodium you're taking in. That's an indication of this disease. So then the next step was to have a CT scan. And I have a video about this too. It was supposed to be a CT scan with contrast, but the first time I had it done, they didn't do the contrast. I don't know why that happened, but basically the CT scan is to look and see if you do have any nodules or tumors on your adrenal glands. And they're going to check to see if there's tumors on one side, on both sides. Sometimes you could have an adrenal tumor, but it's too small to be seen on a CT scan. In my case, they did find one on my left adrenal gland. So then it's like, okay, we're moving along in the progression. Confirmed. So then the next step is to do something called an adrenal vein sampling. And this is where it's basically like a blood draw, but it needs to be done from your veins that are in your adrenal glands. So this is done in a radiology department. It's a procedure. Sometimes you're sedated for it. I was not for mine. I'm planning to make another video specifically about this to go in more detail for people that want to know the details of the vein sampling. But basically they take a sample from each of your adrenal veins and from the vena cava in the middle, and they're checking for your aldosterone, they're checking for your cortisol, they're seeing what level each side is at, and then what it's kind of in that middle vena cava kind of gives like a medium. And basically they do all these calculations with those to determine if your aldosteronism is truly coming from one side or if it's coming from both sides, because depending on that, that's how you're going to be treated for this condition. If you have it on one side, your condition will be treated one way. If you have it on both sides, it's going to have to be treated a different way. So yeah, basically it's a series of steps to, you just want to confirm, because the treatment can be permanent, and we'll talk about that in the next one. So yeah, aldosterone renin ratio, having some sort of salt loading to see how sodium responds, having a CT scan, and then an adrenal vein sampling to confirm. And that is how you diagnose for Conn syndrome / primary hyperaldosteronism.